So this is fascinating and interesting, but aside from diet and trying not to eat too much meat in that sense, what are some practical things that I and my family need to be doing to try and reduce the risk of a superbug that kills everybody?
Yeah. I think we have a handful of recommendations that we can make. There was one point I didn't want to gloss over.
Please.
And that was as far as what you can do. Mm-hmm. And we mentioned that, Joey mentioned, do I have a refill on this antibiotic that I had last year? My sister, she has a Z-Pack left over that she never took, and I'm starting to feel something come on. Or, I had an appointment with my doctor, and they wanted me to ride this out. They wanted me to use some stuff for symptom relief. But now I'm PO'd, and I'm going to the Med Express, and I'm demanding that we get something treated here. Mm-hmm. That's tough. And so what impact can we make as pharmacists, or what impact can you make in your home? As small as it may seem, I would really try to avoid taking the Z-Pack that's laying around. If somebody finishes out an antibiotic for, or if they have 5 pills left over from their cephalexin on their, skin and soft tissue infection, when you think you're about done or they told you to stop, just throw it away, because at some point you're going to feel tempted to say, well, this might help. Yeah. And look, we all think with Google and such, we're clinicians and we have the answers, and this, even though this might work and this, antibiotic might be, this bacteria might be susceptible to the antibiotic that's in my cupboard, try not to use it, because there's going to be a time and a place where you actually need it and it may not work as well. Yeah. It might be a generation down, but that's still the practical thing you can do.
There's always that little feeling that, people say, or that creeps in, like, well, yeah, it's just me. I'm not contributing to antibiotics. It's just me with this one little cold that I can't shake. I have this meeting tomorrow. I know it's only day 8, and my doctor said, he'll talk to me in 10, 14 days. But, that kind of thing, too. It's just me. It's just this one little thing. And that's technically true, but that's where it all kind of starts.
You could be patient zero for the superbug that kills everybody. But no, I mean,
yeah, we don't want to hype it up too much. But those are all little decisions that add up in your own life, which then add up, obviously.
And even to the general population, or let's just say non-pharmacists, that's the spirit ultimately of why we're saying what we say.
Yeah.
What's the big deal? I'm just going to take, my 5-day Z-Pack. Who cares? Well, take a step back. 1, it could be viral. 2, you're going to need it at some point, and it's probably not right now. Did you get a sputum culture? No. Did you have blood work done? No. Did you have a chest x-ray done? Probably not. Unless all of those sorts of things are met, pump the brakes. Somebody will test for it. You can get a flu swab. You can get a COVID test. Whatever the case is, just use a little discernment and wait a second. That's all.
Okay, so somebody in my family is feeling sick. We've got the cough. We've got the sniffles, or what have you. And I don't want to start them on antibiotics because I don't want to contribute to the problem. What do I need to do?
Yeah, I think for me, and all pharmacists have their own little tweaks on things, I try to make sure that patients don't get too wrapped up in like the combo products and like the Advil cold and sinuses and those big fancy names.
Okay.
And if you could just learn a few basic chemical names. Okay. I know that doesn't sound like the real fun part, but just a few basic ones that are in all those drugs and are alone in your cabinet, and just the ones that are going to be used for fever, if you've got a little fever, acetaminophen and ibuprofen, which are Tylenol and Advil. Those are brand names, but at least they're singular.
Yep.
Okay, those are the ones that are going to be used for fever. If your nose is stuffed up, not runny, stuffed, Sudafed or pseudoephedrine.
Okay.
The key thing is, remember, it's pseudoephedrine. That's the one that's behind the counter. Be very careful with it. Elderly, be very careful with it if you've got a history of high blood pressure. But a couple-day course for somebody who's got a really stuffed up nose, really hurting, it's preventing them from sleeping, they've got a meeting, a speech, blah, blah, blah. I think that it is okay for the average healthy adult. Don't let the behind the counter scare you in that sense. Let the facts scare you. It's behind the counter because it's a drug precursor.
Right.
Okay. The facts are, as long as your blood pressure, you don't have a history of high blood pressure, and even if it's controlled and your overall, a healthy adult, there's really nothing wrong with doing that.
And you can
Okay,
always talk to a pharmacist or talk to your
Yes.
doctor to confirm that you're okay to take
Yes,
pseudoephedrine.
exactly.
Okay.
And again, the key word to remember is the pseudoephedrine part. Runny nose, you change gears. This is not so much the stuffiness, it's the runny. Antihistamines. Benadryl is going to work the best, but it's also going to make you drowsy in vast majority of cases. So that could be one you use at night if you'd like, to help use the side effect as a positive. Be careful with that in the elderly. There's short-term and longer-term cognitive issues. It can make elderly can get a little confused even just from taking it short-term, let alone they have seen, if they're taking it nightly.
Oh, wow.
And this is where, and not to go off on this, but where the whole brand name thing gets a little tricky.
Yeah.
Because there are, Tylenol PMs and there are just different drug products that they're just Benadryl.
Yeah.
Relabeled as like, Tylenol PM or Aleve PM, or there's one that's just called, that has like Z's. It's just like Z something. And all it is Benadryl. So that's why I think it's so critical. If you are going to pull these medications off the shelf, to either talk to a pharmacist while you're there or to know, again, not trying to make it too scientific here. It's a handful of them. Know these chemical names.
So is acetaminophen, ibuprofen, pseudoephedrine, and Benadryl.
Yes, and then there's a few more. The antihistamine class, you're gonna have the old one, which is Benadryl. Then you kick over into like the Zyrtecs and Claritins. Those are non-drowsies.
Okay.
And again, they're alone. Knowing the brand names of those is okay because again, they're singular. So you got cetirizine and Zyrtec. You've got that whole family. They're like second generation. So the antihistamines, and then lastly is cough stuff. I mean, you're really dealing with fevers, nose. You differentiate between stuffy and runny, and then cough. Mucinex, Robitussin is guaifenesin. The term you want to know is guaifenesin.
Okay.
That's the one that is an expectorant. So it basically means it doesn't make you stop coughing. It just helps to thin the mucus out a little bit, helps to make it a little more productive.
Got it.
The
Get
other
it
end,
out.
the other end of the cough is the DM or the dextromethorphan. That's the suppressant.
Okay.
So I know through a lot there, but the cough again, guaifenesin and dextromethorphan are your two big terms. Guaifenesin is going to help thin out the mucus. You want to drink a lot of water with that. That's really going to make it help work better. And then the dextromethorphan part is the cough suppressant. That's maybe one you take at night.
Yeah.
Because you don't want to lose your quality of sleep. You do want to watch it if your cough is productive. If you are, getting rid of mucus, you don't want to be suppressing that. So again, that's why sometimes it's good to have these products individual and to understand what these do. I know my list has grown a little bit.
No, that's good.
There's a couple in the cough, there's a couple in the nose, and then there's the two in the fever.
Yeah.
And those are really from a drug standpoint, what I stick with. I'm sure Dante has some other thoughts. The one thing I would want to say not to do whenever it's cold and sinus is the steroid nasal sprays. They're steroids. If you have true allergies and you're using them locally in the nose, nothing wrong with doing that, in my opinion. But you want to make sure, just because it says, for the nose, that you're not spraying steroids in your nose. It's not going to do anything. If anything, it can hurt.
Really? Okay.
If you've got an actual sickness, virus or bacteria, and you're spraying a steroid up there.
So you're saying normally when you're healthy, it's fine to use it, but if you're sick, stop and address it with other
Basically,
things.
only use steroid nasal sprays, no matter what the box says, for allergies.
Got it.
They're not going to help because again, they're marketing. They're going to say things about symptoms, and you may have this cold, this manifesting as a runny nose, and you may grab Flonase, and that's really not. You'd rather do an antihistamine
Got it.
than do something like a steroid.